for granted. Having a very interesting team of guests in the studios who will be part of us and from this time, and they're going to be educating us on a number of issues, especially the issues that concern our health. Health is very important, life is very important, and today we're going to be looking at health and health rights. We're going to be talking about my health, my right. Do you know your rights? Do you know you're supposed to claim some rights, especially from different institutions of government, health facilities, and many other stakeholders? The world is going to be commemorating World Health Day, which is commemorated every year on the founding day of the World Health Organization on 7th April every year annually, and the day is observed in order to raise the awareness about global health issues and highlight the importance of well-being. To celebrate this day, the people from around the globe come together to promote a healthier and healthier world for everyone, and to recognize the World Health Organization achievements. And putting this into perspective, we're going to be looking into all this and how Uganda is progressing as a country in terms of health, and looking at all those institutions that are providing health services to the people of Uganda. In the studios of UBC, I have a privilege to have Dr. Wundo Christopher. Is the supervisor medical services coming from KCCA. Welcome to this edition of UBC Ground Zero.
Thank you, Amon. Good morning, listeners. I'm very privileged to be here at UBC to talk about our rights as citizens to health. And as we start the day, Amon, allow me this early mobilize our listeners, whether they're in Kampala, Wakiso Mukono Oil, any of the 53 districts where we are carrying out yellow fever vaccination, to check at vaccination sites within their community, in their neighborhood, to be able to get this vaccine. Today we are on day 5, and we have 2 more days to go. So the services are closer to them, and we are happy that it is happening at this moment when we commemorate the World Health Day this weekend.
Interesting. It is also a privilege and honor to have Dr. Christopher Wanga, Head of Research and Ideology, coming from Uganda People's Congress.
Indeed, it is a great pleasure to be here. I'm a bit unlucky that I have delayed for some few minutes, and having been in power, any minute you delay is not very good for nation building. So I'm very sorry about it, and I'm making my sincere apologies. However, greetings from the party president, Honorable Jimmy Akena, the USPC fraternity at Uganda House, in the country, in the diaspora, my community leaders of Kaboja A, where I'm an executive member of LC1, and the Chengera Town Council, where I'm also a representative of PWD people. I'm very, very much happy to be here. And when it is health matters, it is an act of faith where we put commitment when we are campaigning for our first government in 1962. And we promised free medical services
to the people of Uganda.
Yes.
Interesting. This is UBC Ground Zero. We are live and clear on 4 radio stations covering entire Uganda. We are on UBC Radio on 98.0 FM, covering all parts of the country. We are also live and clear on Butebo Radio in eastern Uganda. If you're in Mbale, we are 96.9 FM. If you're in Soroti, we are 98.4 FM. If you are in West Nile, we are live on Radio West Nile. We can get us on 98.0 FM, and we also live and clear on UBC Magic on 100 FM. And also we are streaming live on YouTube. You just put Radio Uganda or UBC Radio and you'll be part of the conversation. You have heard from the guests that I have in the studios. We are going to be talking about our health, our right, as the theme for World Health Organization or World Health Day 2024. 2024 marks the 76th anniversary of World Health Organization, and as part of the celebration, World Health Organization chose this very theme, My Health, My Right, as the theme of World Health Day 2024, which focuses on fundamental human rights, like access to health care, education, information, and many others that we're going to be learning in this very edition of Ground Zero. If you can allow me start with you, now with both your Dr. Christopher, perhaps I'm going to be using our African names. If I can start with you, Owundo, what does this really mean to us and the people of Uganda as we celebrate the World Health Day?
Thank you, Aman. So tomorrow, being the 76th day when WHO was born, is a very important day. And we all know that WHO has had initiatives aimed at accessing health to everybody in the country, in the world, and the respective countries have had that obligation to ensure that their populace do access quality and sustainable health services. So it is very important that we keep on reminding ourselves on the commitments that are made annually, and it is one of the days where we remind ourselves to that. But what does it exactly mean? One, we have to realize that the right to health for all is about creating conditions where everyone, everywhere can access high quality health facilities and services, and we should therefore prioritize people's needs in ensuring that we deliver what at affordable cost, so that we minimize wastage, and these services should really be acceptable to the common persons, so that we are able to make sure that the limited resources available are effectively utilized. So this is what our drive should be, that our people are accessing the services that they need. And I'm emphasizing that they need, because many times we tend to go for what we want, and yet resources are not unlimited. So for the little envelopes that we have to deliver service, we do screen out, prioritize, and are able to give the community services that they need. And this should be of high quality.
Interesting. Dr. Luanga?
Yes, please.
My Health, My Right. We're celebrating this World Health Day under this very important theme. What does that mean to you and to the people of Uganda?
Yeah, actually the meaning is deeper, Comrade Amani Butega. I'm a retired government worker, and throughout my time I have worked, I've been contributing tax. And even when I've retired, almost everything I use at home has a component of tax. Since I'm a person who is paying tax even when I have retired, I have all the rights of sitting in my chair at home, and I demand the better health care from the government. More so now, I combine three aspects of where I need health care. One, I'm a PWD, people with disability. I was amputated in 2017 August. And in the process of being amputated by that time, they discovered that I'm diabetic and I also have pressure. So I look forward selfishly on how the government can secure my life and be assured of how my non-communicable diseases can be handled. I have to say this, and I must be very open. I'm very, very much thankful to Rubaga Hospital, which did its part, initial part when they received me, and they said, our capacity, our capability ends here. Can you go to Mulago Hospital as the referral? However, before you leave, pay our bill. And 2, we don't have transport for you. Hire the ambulance. If the family, if the clan had not been more practical and more resolute, maybe I would not have managed that first hurdle from Rubaga Hospital. Then when I went to Mulago, I met a good staff. I cannot complain. They attended to me and they told me the implication. You choose between life and death. Can you sign here? And we amputate. And we are amputating above the knee as per our medical advice. I signed and I went into the theater and I came out from the theater. Then very early in the morning, they said, my friend, we have to train you on how to use clutches. But we don't have free clutches here. Can you touch your pockets and you buy the crutches? So I bought the crutches and they started a bit of training me. Then they said, even this Mulago National Referral Hospital is like a transit hospital. We don't want you here any longer for more than 2 days. Can you please reallocate yourself to Chirudu? Then the family and the clan had to meet that, what is the implication of Chirudu? Are we safe with our patient? It is a government hospital, but such a question came in. Then the family resolved that, this gentleman, let him reside. Let him go to Mengo Hospital. They are the ones who handle these old people with these complications. So an ambulance had to be hired and I had to be taken to Mengo Hospital, Albert Kuku. What? Then
on your coast or Mulago?
Yes.
Mulago coast.
Yes. Mulago had referred me to Chirudu, but the family said, the standards of Chirudu and the distances involved are so prohibitive. Let us take you to Mengo Hospital. So I was taken to Mengo Hospital. And when I was taken to Mengo Hospital, during the recovery, during the recuperation.
Using a Mulago ambulance, or you hired a...
we hired.
Yet you had a right to
we had to hire another one. Reaching that side again, they said, please, you have come here, remove your clothes, what have you, start a new life. But please bring your food and have an attendant. Then the family sat and said, we are hunting money for you. Why don't we just hire somebody who is better qualified like a nurse and will even help you for physio? But the hospital did not know that I had a specialized nurse also who was part of my team looking after me. Then during the day, the family could look after me. And my daughters, and I have to thank them, Miriam Naku, Mutumba Rwanga, Lucy Narumansi, Narishebo, they were indeed very vigilant and they gave me the good cover. Those are my products of Mulungu Shikirabu from Zambia. That's why you can hear some of those strange names.
Yeah, indeed.
Then, as I was at the hospital, I was being told now the do's and don'ts. My beer, my liquor went. They told me if I'm also an active member of British American Tobacco Company, please stop sportsman, stop Rex. Then I was also told which diet to take.
As part of
Everything
treatment.
has no oil. But the way I was being attended to, I was not attended to by one doctor with one discipline. Some were of physiotherapy, some were for diet, some were for what. There were quite many. They helped
that is
me.
Mengo.
Yes, Mengo Hospital. And they helped me. Till they said, my friend, we are about to discharge you. But now, let us talk to you more privately. Okay? If you are disabled like this, most people will run away from you. That is one. Two, you are going to be a burden to so many people. More so if the pockets are very weak. If you have anything which can make your pockets stronger and you have some income generating activities, you step up, think about them right now, and when you leave the office, you just implement. This is when you are going not to have a lot of problems. Then fourthly, they asked me, please, bwana patient, do you have a waterborne toilet facility and bathroom? If you don't have, okay, we request you before you leave this place to make arrangements. Okay? What were they saying? They wanted me to lead an independent, integrated life where I'm not bothering anyone. I can do my own things.
All right.
I can bath, I can do what. Yes, all those things, the family, through family solidarity, we managed to put them in place. Then I was discharged with my nurse attendant, whom I continued with, and I'm very thankful.
Your personal
yes,
I'm from
very,
Mengo.
Yes, we hired somebody. There are so many, except that some hospitals cannot hire. They leave them unemployed. We hired, and I'm very thankful to my female nurse, Mr. Sechans. Okay, he did his part. And then I continued with the physio.
Were you supposed to hire the nurse, or it was your right to have a nurse? Based on your condition.
What was happening was that family members were supposed to take care of me. And yet the family members were taking care of me through raising money. So we said, let us not burden people. If we can have a nurse to look after you, and it helps you even to do physiotherapy, though it's privately acquired. There was also one for the government, but this was a private arrangement. And that's why I shifted with that person from the hospital to home.
If
And
you continued with Marago, do you think you were entitled to that nurse?
That is a private arrangement. Nobody can tell you that don't bring an attendant. Me, I brought an attendant who is qualified. Okay? Not just an ordinary caretaker. And was helping me a lot, especially with the physiotherapy and the exercises. Now, as I reached home and got integrated, I have also to thank my party I represented, or I represent, or I work for. Honorable Jim McKenna and the party simply said, please, nobody should sit in that man's desk, chair and desk. This man is sick at home. The time he will recover, he will join us. And if there is any benefit from work accruing to anyone, let that benefit go to that brother of ours who is in Kaboja, seated recovering. So, what am I trying to say? My employers, and where I offer voluntary service, they picked it from the core values that we cannot punish this man. He did not apply to get this amputated. Okay?
Okay.
Then, of course, I continued to go to the hospital.
Thank you. Thank you, doctor.
And to have the medicine.
Interesting.
Yes.
We share that story, and I thank you for sharing such story. And many others, especially outside there, might be having different stories, perhaps connected to this. And we let you share that story because we would have to many others to learn, especially from this edition. I will put it to you, Dr. Undo, having had that background from Dr. Rwanga, and many Ugandans going through the same, leaving government hospitals, opting for private facilities, which they have to put a lot of money. Yet to have these facilities, government paying so much to pay the doctors, healthy, and many others that are in the sector.
Yes.
Ambulance are hired, caretakers are hired. You are told to buy some medicine outside there, and we're talking about my right and my health. Have we denied some people, especially Ugandans, their rights in this case?
I want to thank Dr. Lwanga for sharing this story, and he has raised some very interesting and pertinent aspects that we need to a bit digest further. One of them is tax. True, Ugandans, we are paying taxes, and of course this tax go into one basket where the allocations happen, and because of that it would be an obligation on each of us, every Ugandan, to be interested to ensure that when government has used your tax to provide services, these services are consumed. I am raising this in the current context because as we are carrying out the ongoing yellow fever preventive vaccination exercise, we have found some elites who have so many questions, and the questions stem from the fact that this is a free service. How come they are giving us yellow fever vaccine for free? What is the hidden objective? What is the agenda? And yet, we have the elites, so those who travel have been paying up to 100,000 shillings to get that dose.
And more, it's according to where you go.
To where you go. But I'm giving you the rate at KCCA because we ideally should give this free of charge. But if a government facility, which is KCCA in this case, has been charging 100,000 for that shot, so now, so we have spent a lot of time trying to explain that yes, the vaccine was available for the privileged few, but that did not stop the government prioritizing, strategizing to make sure that all of Ugandans, no matter the social class, do get vaccinated to prevent them from acquiring this deadly viral infection. Because Uganda is in the endemic belt for yellow fever. And so, even if they are to travel or not to travel, they deserve the right to be prevented from acquiring this infection, and which is transmitted by a mosquito. And mosquitoes are everywhere, as we know. So, the aspect of tax should be really the basis. So, I was thinking aloud that if we had tax tagged to such an intervention and say, we are going to pick money from you, and this should be enforced, but specifically for your yellow fever dose. If that happened, I was wondering whether Ugandans will not demand for it. Because they will say, I have paid for that dose. Please give it to me.
But it is the same, Dr. Wondo, because when I make payments somewhere, there is that tax that is reducted, and there is also direct tax and the indirect taxes. We expect that at the end of the day, that when we make taxes, we are going to get those services, especially from government facilities.
I entirely agree with you, and that's the issue. Because they are looking at it as free, and yet they pay the tax. You get my point? Is that you pay the tax which came into one basket, And part of that money is being utilized to make sure you get this yellow fever at no additional cost. But the elites are questioning, why give us free? So that's why I was wondering.
The vaccines perhaps might be a different case, and maybe this is the first time I've heard of this. Not more often we do carry out these immunizations. But also thinking about ambulances.
I'm coming to that. So, right. But let's also consider.
Ambulances are supposed to be free, or we're supposed to pay for them, especially in government hospitals.
Let's also contextualize this to our setting where my senior colleague here resides. So, as the providers of these services, our obligation is to make sure that we are able to access a critical service like ambulance to all people within our area of operation. As maybe where we have not done well has been communication, sensitizing, alerting people to know that these services are available. So KCCA set up an ambulance, centralized ambulance management system with a 24-hour call center. This was initiated during COVID-19, and it has been sustained to date. And we keep on sharing the call center contacts that please call if you have an emergency. Here is the call center, which is operational. You raise the call center, they will do triaging on phone to identify the most likely referral point you deserve to be sent to. And but what we realize that some people, of course, if you assess the calls coming in, there are a number of people who are making use of this, but we also know that there are so many other people who don't. So, and this is entirely free of charge service. So, and I'm sure you saw those ambulances, the additional ambulances that we procured following COVID-19. They were added to the fleet we had, and they are all doing this service, providing this service to the residents of Kampala.
If they're there, why are people paying for them?
And for no, they are not paying for them. I think Dr. Luanga clearly indicated that he hired an ambulance from Luvaga.
It was at Mulago and was going. Yes, Mulago to Mengo. He had to hire an ambulance, and many Ugandans are paying for these ambulances every day.
Now, beyond the boundaries of Kampala, there are issues related to fuel and so forth. And if you have an emergency and the government ambulance maybe has that limitation of fuel, the obvious thing to do is to look for the alternative, and maybe that's where they're paying. But we know that the government has made steps to put up an ambulance coordination, the National Emergency Coordination Center office with a full commissioner at the Ministry of Health, and they are building capacities of both the person supposed to manage this ambulance and also the fleet of these ambulances. So we think that this is work in progress, and within time we should be able to have this sorted. Right. And the other he raises from his story is the aspect of infrastructure for health. Infrastructure for health, and this, could be, for example, non-communicable diseases where his condition falls. Diabetes, high blood pressures, heart diseases are on the rise, especially in urban setting and specifically in Kampala City, for the obvious fact that we have a lot of sedentary life, and also what we are eating and the air we are breathing in are not doing any justice to our bodies. So if I'm sure Dr. Luanga now knows that significant proportion parts of Kampala do have non-motorized roads. This is intended to compel people to exercise, to walk. And this is one way of making sure that even if roads are under works and engineering, but they listen, because this is one government, they listen to the professional guidance from the health sector, and they make these adjustments to make it possible that those who have been seated in the car right from the door of their house to the office, somehow, somewhere, find themselves that the only means available to reach their final destination is to walk. But we have also programs that are encouraging institutions to do physical activity, to have a declared physical activity. And we have key stakeholders. For example, tomorrow, we are very grateful to the Kabaka for the initiative for the Kabaka Run. Because, you know, before you run, you should do exercise from wherever you stay over a few days, so that when it is time for the official run, you are a bit fit to be able to undertake that venture.
Many people don't actually do those preps, and they come only to run 1 kilometer, even less, and they start fainting.
Yeah, that is...
so we should first do prep somewhere before we come for the run.
Right, you need to do this. Give yourself at least a 2 weeks period. Do some progressive, because we discourage heavy exercise all of a sudden. It will bring you many challenges, and you may detest doing this exercise going forward.
Dr. Wundo,
Yes.
How are you considering the cases for persons with disabilities? Dr. Ranga has shared his story, and many other Ugandans are also facing the same challenge. You go to health facilities, but there are no provisions for people with disabilities. We're talking about how many years now?
Now, as you say, disabilities are varied. There is a big varieties of disabilities, and the services are available at different levels, depending on what disability we are dealing with. You know, our health system provides for a referral pathway right from the first level of access to health care, which is health center, officially now health center 3, there 4, 5, and all these are manned by persons depending on their capacity in terms of training, but also capacity in terms of tools, equipment, and any other infrastructure available at that level. So you will find that depending on the nature of disability, there are services you will find at Health Center 3, those at Health Center 4, at General Hospital, Referral Hospital, and National Referral. So not everybody will find the services at the first point of contact. And from the story we have seen that there was a referral. Even Rubaga Hospital could not provide all services that he needs. So that is how the system is designed. Right.
Interesting. Our dear listener from UBC Radio, Magic 100 FM, Butebo Radio, and West Nile Radio, you're going to be part of the conversation by reaching to us on 776 511 426. 0776 511 426 is the number that you can call, or keep your messages coming through on 0701 24 26 47. We are talking about my health, my right, which is the theme for 2024 World Health Day. And in the studios of UBC, I have a privilege to have Dr. Owundo Christopher, is the supervisor medical services coming from Kampala Capital City Authority, and Dr. Christopher Rwanga is the head of research, ideology and documentation coming from Uganda People's Congress, and Ampaide Amanotega is my name. Let's talk about immunization. I don't know whether the exercise has ended or it is still ongoing. But some Ugandans have had issues and concerns about the same, which a few mentioned about. But before I come to you, Awundo, I would love to start with Dr. Rwanga. Do I have a right? We are talking about my health and my right. Do I have a right to deny the vaccines, or to be immunized, or it is to be forcefully given to me as a patient? We have had government and different institutions enforce this, especially in schools. Do parents, do children have a right, first of all, to be told what these vaccines of immunizations are about? Two, do I have a right to deny or accept?
Thanks very much for putting up that question. Normally, when it is a health service to be given to the country and to its citizens, it has to be explained properly and without any doubt. But where we are having a serious challenge is that our level of education, our traditional beliefs, and management of health matters at times is not balanced. Uganda is a country where immunization is interpreted in several ways. They will say that immunization, they will introduce a disease in you, and that very disease in you will make you weaker, will make you die. That is a very strange way of explaining things. Yes, when you are immunized, you get that immunity, and that sort of disease or what have you is made part of your body scientifically, that wherever it comes, you can resist it. You have better resistance. But they don't explain it to the lay person properly. It caused the problem in Kenya. It caused the problem in Nigeria. Even in Uganda, it causes some problems. Like when we had COVID. Me, I took the first COVID jab. I took even the second one, and I even took the third one. But my mother, who is 97, we said, please, can you stop going to church as the first precautionary measure? Secondly, can we go for vaccination? Thirdly, can you stop all those movements you used to make to neighbors? If there is anybody who wants, you should find you at home. But much as we did those precautions, still COVID came and picked on her. And it was one of our domestic helpers who tipped me that, please, can you look at the old woman? It is as if she's sneezing and she still wants to continue to work in the garden. Because my mom at 97, she has that routine, waking up at 5, going to garden, doing this, doing that, and wanting to knock off past 1, and then resting and seeing how we can resume now reading newspaper, what have you. So we organized and she was taken to Rubaga. Immediately they detected the COVID. But since she had had all the doses together with the booster, the attack of COVID was not as severe as it should have been in the first place. She put up resistance, she got the injections, and the next day she was back on the road doing the heavy work. I suppose if we had not done all those procedures of vaccination, my old woman now would not have clocked 97. She clocked 97 in November last year, but she would not have clocked it, I suspect very highly. Such that whatever immunization which comes up, it has to be explained to the people properly through communication. The only disadvantage we are having now, people communicating government messages, whether on health, whether on land, whether on what, some are
Apart
not.
from being a requirement, is
Yes.
it my right that I have to claim for it?
You have to do what?
I have to claim that right.
That right is, when it comes to health matters, you are a state property. That one you should know. You are a government trophy. And when you are a government trophy, the
Whether you want or not, I
whether
have
you
to
want
be
or not,
immunized.
you have to be immunized. Because if you are not immunized, you will spread the disease. And to contain that disease, the government will have to bring extra resources, divert them from somewhere, try to treat you, okay? And in the process, because you have refused, your treatment may even be very, very difficult and costly. And some of these diseases where you refuse to be vaccinated, at times they come as an epidemic. And to deal with an epidemic, it raises a lot of questions to most of the health systems. I can give you an example. A country like Britain is super developed. But now they have a challenge that most of their citizenry cannot afford these demanding jobs of being a nurse seated there, following up a patient from the morning to evening, or even being a doctor. They have said those are not now our jobs. And right now, as we are speaking, Britain is busy importing people from Africa and other parts of the world to go and help their health care system. And yet it is their people, like Dr. Albert Cook, whom we commemorate and we pay tribute in Mengo, with even a word, who came here to teach us about modern medicine, modern science, modern surgery, and what have you. Okay, so when you say that you are not going to do that, the government has a responsibility to tell you to do it.
But
because
based
it is
on
a
some cases
Yes,
in the
please.
country and somewhere else, whereby people have been given fake shots, immunized on fake products,
Yes.
that would in one way deny some people trust in these vaccines, and perhaps deny some of them.
Let us not.
You remember in 2021 when the ministry said that between 80,500 Ugandans were Ugandan shillings were paid, that is 25 US dollars on fake shots, and many people were lining up for these shots. And KCC, I remember, was involved in this case to deal with those criminals or culprits. And many Ugandans became victims of this.
Let us not confuse things at a certain level. There is where the system has challenges.
But we learn from those challenges.
Yes.
Next time I heard someone was given water as a
I want to say this.
next time I would fear to take any other
I want to say this.
vaccine.
When Idi Amin collapsed, there was a certain type of immunization which was done after the Amin War. And my family members, a brother and a sister, they had their 2 children who were immunized. The vaccine had some issues, and they got affected. One actually died some few years ago, and another one is still carrying on, but they are disabled. Others on the village, they died straight. Some could not push throughout to 5 years, but these have pushed The one who is surviving now in our family is about 30 years. But that had to do with the situation that we are coming from the war. And when we are coming from the war, some of the experienced people died, the rain, and we are still terrified, but activities had to resume. So in the process of resuming, a certain wrong immune what was given out. By the time they realized to recall it back, problems had been already registered. But that was an extreme case explained because of the collapse of Amini's government and the collapse of the medical services and the collapse of so many things.
And learning from such challenges, and
it was part of the recovery. Now, where we are now, okay, is that much as you have seen, the government has integrated the private educationists in the system. It has not been so easy to integrate private medical practitioners because they always crop up. And our country now is having a serious problem. Much as the various people crop up in the medical field and treat this, then also in the pharmaceutical world, several people are cropping up with various pharmacies. And whoever now is doing this sort of clinic work has also become a pharmacist, because if money comes on the clinical aspect, you grab it. If money comes on the pharmacy aspect, you get it. However, there is a government system even in our village, okay, where those clinics are registered and they are supervised, and there is even where they enter the details wherever. Okay. But those are few. Now, these mushrooming ones are the ones you are referring to, which use fake immunization facilities. So my appeal would be, unless it is a recognized private medical facility which is working hand in hand, those are the ones where we should entrust our lives. And some of those facilities have been even given right to handle pregnant mothers, though they are private. Those are decent. They are not for money making. These other ones you are talking about, they are the ones who are mushrooming, and where they will just put on a gown, a stethoscope, and they talk that funny language. But that is not government policy. It is just because our medical facilities, which are official, are still very far away from the people. And these take advantage to take those fake facilities near the people.
Interesting. Yes. Thank you so much, Dr. Wanga. 776-511-426 is the number you're going to call in the next hour, and you're going to be sharing your concerns, especially about immunization and many other concerns that you get from health facilities, especially in Uganda. What is the immunization policy in Uganda, Dr. Wundo, especially on the immunization of children? Don't you think it is someone's right to be informed when they are going to take these jabs? You go to schools, you start immunizing children, even without consulting their children, I mean their parents. And some children have some cases or illnesses, and after taking some jabs or being immunized, they develop some consequences or the side effects of this, and later the cost goes to the parent, and then you withdraw.
Yes, Amon, allow me supplement what my senior colleague here raised, then as we move to that question. The question is, what is the right to health for you as an individual? Because this may be interpreted wrongly. The interpretation could be that it is my and therefore
And my right.
Yes, that is the fact that is your life, your health. But you, for example, if it is your life and your right to it, which I agree with, but you may misinterpret it and say, I may choose to take away my life. Will that be acceptable?
Not really.
If you attempted to take it away, the government will arrest you and charge you for attempted suicide. So when we talk of right to health, it means that you, consumer, the person, you put it to your government, provide me with the health services that I need so that I live a healthy life. The responsibility you are putting it to government. Do the best you can because you have the expertise, you have the professionals, so that I have a healthy life. We need to look at it in that context. And I will give you a bit of example in respect to this immunization. Now, countries which are developed will say that if you are not vaccinated, you are not welcome within our borders. In Uganda, how else could we tell those who said they don't want to be vaccinated? Could we say they are not welcome in our borders? No, it is their home. So what's the best to do is to give them the information, and this is answering your question. Give them the information, educate them, but we expect them to trust the professionals in Uganda because we understand the thing better than them. Through their taxes, we have been empowered to and committed a lot of time to understand the dynamics on immunization and therefore make sure they take the right quality service. The question of fake products, this example you are raising, coincidentally, I was the whistleblower myself who started off the whole thing. And how did I come across this?
When they were giving people water.
The water, the fake.
In the name of immunization of COVID-19.
Yes, right. How did I come across this? I was supervising mobilizers to ensure that we reach out to all places where people are congregated. So I reached one factory in Luzira. As soon as I entered, I told them what has brought me. They told me, oh, but your team has just left. I said, what? Team has left? I said, yes, we were paying. They were charging this. I said, give me the details. I called the RCC, I called the DISO, and we started the money hunt. So that was the alert that we have a wrong category of persons moving around. Because these vaccines were highly controlled, there is no way the vaccines could leave our supply chain system without my knowledge for Nakawa, where I was accountable for. And that was the beginning. Eventually, because we knew they are moving from factory to factory, until eventually we grabbed them. Now, there is no way we would expect us to keep quiet on such matter, and yet our responsibility is to protect the public. So when the fraudsters, it is like the electronic money fraudsters, these people who are stealing money from mobile money. Should we say that therefore we close off mobile money services because there are fraudsters who are doing so? It can't move that way. So it is the duty of the professionals assigned that responsibility to monitor what they are doing and alert the public to make sure that we do not they do not get a wrong service amidst the correct service. Now, coming back to the parents and children, you see, these children move to public spaces. They are either in kindergarten, schools, and they are interacting with your child, my child, everybody else's child. So we know that when we give immunization service, most vaccines, we shall achieve between 85 and 90% effectiveness. What does that mean is that if you vaccinated 100 people, at least 85 to 90% will develop the intended immunity for that vaccine. There will be about 10% of them who will have just received the vaccine, but they do not develop the intended vaccine due to the nature of their body setup. So if your child is not vaccinated at all, and is coming on the background of the family doesn't believe in vaccination, it means the people around that child are most likely not vaccinated. So it is an island of a highly risky group. It means that this child can easily transmit, become a carrier of that immunizable disease and bring it to the risk of these others, the 10% who religiously wanted to protect themselves, but they did not achieve the immunity. So if you do not want your child to be vaccinated, the question is, are you okay to make sure your child doesn't interact with the rest of the other children?
Impossible.
But then why should your right affect my right?
Dr. Wundo, don't we have exemptions of exemption cases of people who are exempted from being immunized?
Yes, we do. So, and that's why we give information, and that's why we train all health workers we deploy. For example, in the ongoing yellow fever vaccination, we have exemptions. First of all, we are targeting children between 1 year, people of 1 year to 60 years of age. Anybody above 60 years is exempted. And those below 1 year are exempted. We also have exemption if they are of pregnant women. We are not vaccinating them. Of breastfeeding mothers, we are not vaccinating them. We also exempt people who are allergic to eggs for this yellow fever vaccination.
If
you are allergic to eggs,
I'm not going to take a yellow fever vaccine,
yes,
or immunization.
Yes, if you are allergic to eggs, because of the protein setup. Some of the protein setup in this vaccine resemble the setup in the egg. So if you are allergic to it, we don't want to give you an allergy. So
do you give this information before someone is immunized?
Yes, this is the training we take all our health workers through. We give them these guidelines, and they are supposed to just ask a simple question: do you eat eggs?
But a child of 1 to 2 years may not be able to answer that question.
True, they will not be able to answer, and that is why when we communicate to, say, these kindergartens, we ask them to inform the parent. We don't ask them to ask for consent. You see, there are two mixing. We say inform the parent. A responsible parent will take the initiative and alert the school that, oh, my child is allergic to ABCD. And I have seen communication that they are excluded from vaccination. So that is what we do. And you have seen also with the government making a lot of investment in social mobilization. This social mobilization is about giving the correct information, informing the public. We have done this through social media platform. They are doing it over radio, TV program. We are doing it through mobile public address systems. So that people are aware. We encourage them to get just the interest to make.
If I'm exempted, do I have to bring anything to prove that, or
No.
one way perceive it as I'm giving excuses not to take the
No.
vaccine?
No, first of all, yellow fever vaccine is very expensive. Number two, if you are exempted, if you tell us you are exempted, we shall
Celebrate.
assume. No, we shall assume that you appreciate the fact that this is service, you need it, and therefore it is not we assume that you are not giving us false information. We are not asking for any proof because we are asking people to come where we are vaccinating from. But for groups, organized groups like schools, places of worship, we go and ask them. And when they come, like in Kampala here, we have a significant proportion of children who travel via Entebbe, and therefore they are already vaccinated. We ask, and they tell us, for me, I think I got the vaccine because I was traveling such and such a place.
Thank you, Dr. Wondo. This is UBC Radio, and we are in UBC Butebo in eastern Uganda, Western Nile in Western Nile or in Arua, and Magic 100 FM in Kampala. We are taking a very short break, and UBC Ground Zero comes back in just a bit. I pray you don't go away. After the break, I'll be picking your calls on 776 511 426, but also keep your messages coming through. I can see Jen from Palisa, I see Margaret Akelo, I see Kaliango, and many others. Keep your messages coming through on 701 24 26 47. I'm coming back in just a bit. I pray you don't go away.
This is Ground Zero Season 2. Stay tuned. We shall be right back. Every Saturday, UBC Radio broadcasts the Information Hub, your one-stop dial radio show. Join us to learn and know more information about innovations, research, and developments. The Information Hub. Knowledge is power on UBC Radio, inspiring Uganda. This is UBC Radio. Tune in for news.
At UBC Radio, we bring you Uganda's latest news and information.
Focus on Parliament.
What we need to do, the Prime Minister must give us the position before we finalize the budgeting process.
Enjoy sports. The environment. Politics.
The mission we have is socio-economic transformation.
Health, entertainment, updates in education. Keep tuned into UBC Radio, inspiring Uganda.
At UBC Radio, all our radio network across the country is committed to inform, entertain, educate, and guide for national transformation.
Our own radio, UBC, should set its own example. Leka bano abatafa ku bantu baffe bagumaza ndowooza Muganda hita okugumaza to divert people. Let our own UBC bring programs to educate the people so that abagala kugumaza babeereyo bagumaza naye naffe they can advise, guide. And people in time will judge the one who is their friend and who is just using them.
Tune into UBC Radios for credible socio-economic programs. UBC, inspiring Uganda.
The Education Forum program. Education Forum, a platform for trends and developments in the education sector. We are your reference and reliable source of information. The Education Forum, right here on UBC Radio, inspiring Uganda. Welcome back. Ground Zero Season 2 continues.
UBC Ground Zero continues. Welcome back from that very short break. Ampaire Amon Otega is my name, and I have in the studios of UBC a very special team of guests. Dr. Owondo Christopher is the supervisor medical services coming from Kampala Capital City Authority, and Dr. Christopher Wanga is the head of research, ideology, and documentation, Uganda People's Congress. We're talking about My Health, My Right. We're going to be joined by Susan Elaborata, who is the quality manager, Uganda Blood Transfusion Services, would love to know how much blood we have in the country. Is it my right to get blood, or I should pay some money to get blood? Some concerns have been had from a number of facilities, and would love to get answers from Susan, and that will be having right information from the horse's mouth. We're continuing with the UBC Ground Zero. We're talking about my right, my health, my right, and keep your messages coming through on 0701 24 26 47. But also in this hour, it is the time that you call on 776 511 426. If I can use this time to read some concerns from the people of Uganda who are part of us from the other side of radio. Someone says, thank you, Dr. Rwanga, for educating us. And, I picked a lot from your story, and it's not far different from my father, who was amputated of the arm. Also, someone says, fuel in, they tell us that the ambulances, and they are always parked outside. Indeed, you would know that they do have, and they don't lie. But when it is time to use these ambulances, you are advised to pay fuel. But if you are to convert this cost, and the money they tell you for fuel is equal to that of hiring a private ambulance, it is in another way of saying that ambulances are here, but they are for hire, even when they are for government. Ironic. That is Margaret Nagulu. Also, some Margaret Akelo, Jen, that is Jen, and this is Margaret Akelo, says COVID-19 vaccine still there. In case I missed, I would have to take one. Or are they comparatively when I'm traveling? Agre is listening from Mbale, says, thank you so much for the program. I'm learning a lot. But I took a yellow fever vaccine in 2019. Can I take another one? Also, Kaliango is listening in from Chebando, says, Doctor, you talked about from 1 year to 60 years. But some hospitals are even immunizing children below 1 year, especially those that are 9 months and above. Is this acceptable? Okay, allow me go back to the studios. Also, someone says, why immunize now? Especially on, I think this means yellow fever. Why is it now? There are people who are allergic to immunization. How are you handling such cases? Okay. If I immunize it, is it forever, or I need to immunize again? Okay. Also, someone says, I think that was answered. Who are those who are exempted from yellow fever immunization vaccine? Okay, let me start with you, Wundo. Dr. Wundo, you've had concerns from the people of Uganda who are part of us from the other side of radio are raising these concerns. If you can answer them.
Thank you. For the questions, the callers, those who have sent in messages. I will start right away from Margaret on the issue of ambulance. I think this is a story you will pick from so many people elsewhere, but I really want to challenge her that you will not pick that same story of no fuel with the ambulances in KCCA unless you are not calling the right call center number. So for KC ambulance, the drivers do not ask for fuel, and they are even not assigned, but you don't call the driver. You are calling a central coordinating team that assigns the driver. that links you to the driver. And if at all it ever happens, because sometimes you don't say it is never possible here. If at all it ever happens, please, my advice is get back to the call center, inform them that you have been asked to contribute towards fuel, and we shall make sure we sort that and reprimand whoever may be trying to fail our system. And for that matter, I will share the call center. Of course, this only applies to Kampala. And our call center number is 0800 299 000. Now, when it comes to COVID-19 vaccines, I mean yellow fever vaccine, the one who got yellow fever vaccine in 2019, the yellow fever vaccine is a one-off shot. You get it once and that is enough for life. Previously, those who were paying for yellow fever vaccination, they would be given a card valid for 10 years. You know, for all vaccines that come on board, WHO and other health development do what we call cohort studies to monitor the effectiveness of this of the immunity generated by this vaccine over time. So when it is new, like we had the new vaccine like for COVID-19, we were vaccinated. A number of persons were enrolled in these cohort studies to know when will the immunity remain effective within your body for how many years. So over time, for yellow fever, WHO has established that there was no need for a follow-up or booster dose, and therefore a one shot is enough for the entire life
of yellow fever.
Yeah, of yellow fever. And we have been,
even when my card is expiring in 10 years.
What you do with that card is if you got the yellow fever from KCCA, bring it back and it will be swapped. You will be given without another shot.
If it is a lifetime immunization, why give card that expires?
That's what I have just explained, that because yellow fever was a new vaccine, the initial studies had pointed that within 10 years, there may be need to boost and give a follow-up.
Interesting. All right.
But the cohort studies, which studies the people over time, have established that the immunity is as effective throughout the lifetime of the person.
Those with
that
the
is
cards that
we are now
10.
swapping. Those who received the cards with 10-year expiry, they come back to KCA if they got them from City Hall, and it will be swapped with the
lifetime
an open one.
Open card. All
yes,
right.
Right.
That's okay.
And there is a question of those health facilities which are vaccinating
children below 1 year
from 9 months. Yes, I want to thank this observation because the person asking is really vigilant, and I'm very happy for him. Officially, we introduced yellow fever vaccination in the routine vaccination schedule in 2022, June 2022, and we are vaccinating children aged 9 months and above. Their dose is given at 9 months. So that is the routine vaccination campaign. Our assumption is that most of the children who are 9 months and 1 year to 1 year and have been getting routine vaccination already got this yellow fever vaccine. It would be real wastage of resources to take the age back to 9 months when in the routine vaccination at the health center they are giving it. So we know that since this was not, we have been struggling to ensure that the vaccination uptake is 100% throughout the country, where we have not yet reached. we think there are many children above 1 year who may have missed this shot at 9 months. So the health workers are asking whether the child got this shot, and they will not be given because it is a one-off. So there is no problem with that. Why immunize now? This is a very important question. First of all, the fact that Uganda is in a yellow fever endemic zone need to be appreciated. We have had yellow fever outbreaks over time. The most recent within our neighborhood was in Wakiso in 2022. We had another outbreak in 2020 within Wakiso. We've had a number of cases in 2021 in Masaka, in Luero, and other districts. Now, we also know that because yellow fever is endemic, we could be having people who get yellow fever, but the health-seeking behavior of Uganda is not entirely uniform, that they will run to the health facilities.
Okay.
Some, we may miss them, and we cannot declare an outbreak until we confirm a case.
Right.
So, secondly, yellow fever is a very expensive vaccine. It needed commitment, government to mobilize resources for the vaccine, to secure the vaccine, to buy that vaccine. We are lucky that it is now available at this time. And therefore, the best you could do for your people is to give them. Though this exercise is going on in a phased manner, we are currently running phase 2.
Okay.
There was phase 1 in 2023, and there will be the final phase in other districts in October this year. So it is the fact that resources, yellow fever vaccine were now secured, and we would wish to eradicate or eliminate yellow fever out of Uganda by vaccinating everybody.
Thank you, Dr. Wundo. Dr. Rwanga, someone says, I am Jimmy. I like the examples that are always that doctor always give, especially from the Zambia experience. But I think the problem with our system here in Uganda is corruption. If we had dealt with corruption, I think we would be getting free ambulances, free services, medicine would be in the hospitals, doctors would be doing their work, and everything would be well. Dr. Lwanga?
Yes, please. Indeed, it is very good for some of our citizens to have opportunities to travel elsewhere, and they do some benchmarking and they appreciate this situation. In Zambia, where I constantly give examples, is because I was lucky. I worked in a rural province, which you could call a village, which was about 550 kilometers from Lusaka for about 12 years. Then I shifted to the central region, which is more urban and along the line of the railway in Kabwe. But I found when they have very good arrangement. And this arrangement in Uganda, we don't have it. When you stay in an area, there is a way that area is now attached to more of the health facilities. And within those very health facilities which are within the area, they develop teams of like medical workers who are footing or who are riding on the bicycle to check on some of these people who cannot be admitted in the hospital again and who are at home. But more or less, most of such type of patients are isolated. They are not even attended to by family relatives. They have given up. You have been bedridden for about 5 years. People give up. Then also they ensure that most of the patients recover very well when they have a good diet. So they also take the package to those people and check on them routinely within manageable zones, within manageable areas. Of course, here I've also had examples of village workers, but our village workers are not well facilitated like those people in Zambia I refer to. Then also in those areas, Zambia, which I lived in and I saw, government and private, they share some of these critical services like ambulances. And their ambulances are not permanently attached to a certain hospital within an area. Then the other element which I saw, which again Uganda has to do much, is that retaining medical personnel is another thing. And when the medical personnel is not retained and there is a serious hardship, Zambia could not hesitate to hire expatriates in that field to as a stopgap measure. Us were hired as expatriate teachers, and even in the medical profession, they could do hire. And where there is this sort of international help which is coming in, they welcomed it with both hands. But this sort of international help which comes in, at times it is routine and it can finds you regularly. But at the same time also, when you are running a government, you need also to establish these sort of connections. Like for instance, Kaunda's name was an international passport, and so many countries use the always to say, no, we want to bail out Zambia. Zambia is having this problem. So also that one helps a lot. So you will find that I will always refer to Zambia because I understood their politics. I understood how they valued their human being. We enjoyed our lives. We grew up there, and we understood their system.
All right.
Yes.
We have some cases where people are buying or advised to make some payments to have blood. And some people think that it is their right to have free blood. How true is that? And how should Ugandans be helped?
Yeah, the issue.
We have Susan online. Susan, you're most welcome to UBC Radio.
Yes.
This is UBC Ground Zero. We are live on 4 radio stations.
Yes.
We know that we just concluded the African Society for Blood Transfusion Congress. How was it from your experience? And now that you are part of the organizers, as Uganda Blood Transfusion Services in Uganda, as the host.
Yeah. Thank you so much. The Congress was a successful Congress, the 11th Congress for the African Society for Blood Transfusion. We had an overwhelming attendance from both local and international delegates attending this Congress. From the theme Adopting Global Innovations, ICT Technologies, we had very wonderful scientific presentations from all the Congress delegates. In terms of achievements, the Congress was quite successful in many areas. Most of the delegates were very impressed with Uganda at large, and we hope and we know that the delegates that attended went with a lot of information in the areas of ICT. There were many deliberations in the areas of patient blood management in the country. That is a new direction that we are going into in terms of blood transfusion services, advancements in technology. We had a lot of exhibitors from about 3 or 4 countries presenting advanced technologies, and delegates benefited from these new technologies that are upcoming, and we hope that the country will adopt most of them in terms of improving blood transfusion services. So overall, in terms of organization, we were successful. So the delegates were impressed from the feedback that we were given. Of course, doesn't go without other challenges that we incurred in the background in terms of organization, especially financial challenges, but we overcame them, and everything went on well.
Interesting. We are talking about the theme for this year, World Health Day, and the theme is, which is our topic today, My Right, My Health. people of Uganda entitled to free blood, or there is a cost that is attached to it?
Yeah, currently, the policy is blood is free for all patients, for all Ugandans and non-Ugandans that are attending health facilities in the country. So as Uganda Blood Transfusion Services, we give this blood to hospitals free of charge. But when you say free completely, we may not say so because the government pays for the cost of processing this blood product. The donors donate this blood free of charge, but when this blood is brought to the blood service or to the blood bank, it goes through a lot of processing in order to make it safe and efficacious for the patients. So there's a total cost, an overall cost of about $81. So that is the cost that the government pays. And so, but however, the patients must receive these blood products free of charge at the facility level. So you can perhaps add that the patients have a right to receive these blood products free of charge. However, at the hospital side, there are other hidden costs which may be called overhead costs, which, for example, nursing care, the giving sets, if you went to a private hospital, the bed services overall, those may be charged. And perhaps that's where people may be misunderstanding that they're charged. But however, I must say that blood is free of charge. Nobody is allowed to pay for the blood products that we give as Uganda Blood Transfusion Service.
The country, do we have really enough blood, or we are still lacking, and so we should call upon Ugandans to join Uganda Blood Transfusion in terms of donating?
Yes. We call upon all Ugandans that are eligible to donate. When I say eligible, we have a criteria that we use for selecting eligible donors. But however, every Ugandan 17 years of age and above are eligible to donate blood as long as you're healthy. You're free to come, and we welcome you to come and donate blood in many of our centers countrywide. We have regional blood banks, we have collection and distribution centers countrywide. So, and also within the city here in Kampala, we have sessions ongoing on a daily basis. We have fixed sites, and above all, we have even introduced the night shift. So you may not be able to donate during the day because of the work schedule, but we call upon Ugandans at Nakasero. We have someone attending to you even in the night. Of course, that is mainly to cater for emergencies, those rare blood groups that we need. So we welcome all Ugandans. Please, this is a noble cause. Please donate blood. You will be a hero to save a life, to save a mother, to save a child. Cancer patients, the Cancer Institute, most of them rely on these products to survive. So please, as a Ugandan, we welcome you to donate blood to save lives of patients.
How are you working with the private facilities, or which most of the patients? In case I started my hospital today and I would love to get blood in the next day, how am I supposed to get it?
You mean the private hospitals?
Yes.
Yeah, private hospitals are served as the same as government hospitals. They do not pay for these blood products. Like I said, perhaps they could charge for other costs. But however, some of them, for example, those that really value this, they support us and they also organize for blood donation activities, and then they call upon us as a blood service to go and collect blood from the population or the community that they have organized. So we still also want to encourage other private hospitals to do the same, because we are all blood donor recruiters in our capacities. So private hospitals do participate, however much they also don't charge for these products.
Interesting. Susan, in every exercise, there are always myths and misconceptions. Have you encountered any myth or misconceptions surrounding blood donations?
Um, of course, there are misconceptions from which could be cultural, could be human in nature, but most cases we have procedures in place that we follow. We have policy guidelines that guide us in these areas, and that's how we overcome most of them.
Interesting.
Yeah, yeah. So
Your as we talk about my right, my health, my right. What are those rights patients need to know, especially in acquiring blood?
Of course, the most glaring is that every Ugandan is entitled to these blood products, irrespective of their religion, irrespective of their gender, irrespective of their background in any form. They're entitled to these blood products free of charge. And so patients also have a right at times to, we obtain consent from their blood recipients. So as a medical personnel, before you give a patient a blood transfusion, they have a right to consent to this blood transfusion. So once we have obtained this consent, that's when the health workers go ahead and transfuse the patient with these blood products.
Your last comment, Madam Susan?
Sorry?
Your last comment on this?
Yeah, of course, above all, the health workers will also, on the other hand, for example, we have the Seventh-day Adventists, not Seventh-day, they called the Jehovah's Witnesses. Their religion doesn't accept them to receive blood products. However, they do, the health worker does their best to educate the recipients of this blood or the people from this religious background such that they understand the importance, how the blood products may be able to save the life of the patient.
Okay.
However, there are alternatives to transfusion, which the doctors may take in the event that this patient needs to save a life. So there are alternatives to transfusion, which we encourage even the health workers at the hospital to adopt for this kind of patients.
Okay.
Yes.
Thank you, Susan, for making a point to educate the people of Uganda on UBC Ground Zero.
Thank you so much.
Wish you the best.
All right. You're welcome.
Joining us was Susan Raboreta, is the quality manager of Uganda Blood Transfusion Services. Thank you for that information. 776-511-426 is the number you can call. UBC?
Yes, good morning.
A very good morning to you.
Thank you for the show. This is David.
David, you're calling from?
I'm in Kampala.
All right.
I want to appreciate the program.
Thank you.
And thank you for serving the nation.
Thank you, sir.
Actually, I've been following this program from the start up to now.
Thank you.
There is one thing I first want to inquire to make listeners also to understand from that very teaching going on. Whenever people are donating blood or when they are picking blood from our Ugandan, you find that even if a sick person, someone who had a disease within himself or herself, you find that they collect all the blood, they take to the responsible places. But you find the result of the blood that last time they took, if they bring it back to the station where last time they donated from, it take time and they cannot be clear to say, yeah, or David or whoever removed the blood. Instead of giving the right answer to what they have picked in the blood, they can't bring it back.
Okay.
This person remains saying, yeah, for me, I donate, I'm serving the nation. And yet, kumbe, this blood had problem, and from there they are throwing it away, or it had gone where the owner could not find now.
Okay.
How did this person who donate and yet he had a problem within his blood will be in a position to know that kumbe he was wasting his time to donate the blood?
Okay. Thank you. Thank you, David.
And also too, I'm sorry to take time. People, Ugandans are serving the nation through donating their blood to people and to those who are in need. But you find that this person remain donating. Government, it is dormant to think of these very people who are serving the nation. What really benefit would this person who is donating?
Thank you, David.
Thank you for the program.
Okay. That is David raising a number of concerns. UBC? UBC?
Yes, you are talking to MJ from Makinde.
MJ Makinde.
Mm-hmm.
All right.
Good morning, and thank you for the program.
Thank you, sir.
Me, I have a question to things concerning yellow fever.
Yes.
Because many people have rolled out now for vaccination, but they never gave us the yellow card, so we are not sure where shall we get it. They don't even inform us where to get the yellow card. Because people are traveling, but we don't know where to take the yellow card.
All right.
Then, thing concerning the blood transfusion, I think government would be I think they should moderate the way they are giving the way to talk to people, how to transmit, to give the blood to the country, because people are not motivated enough.
All right.
They have to motivate people so that people can get feeling that.
How should people be motivated in this case?
I know. I think they are not, because that's why other people they are relaxed. They don't give blood because they're not motivated enough for it.
Thank you, MJ.
Someone is donating his blood. The next time you go, sometime you find the blood is not there. So they said, "I've been giving my blood."
Okay. Thank you, MJ. UBC Ground Zero. We are on Magic 100 FM, UBC Butebo in Eastern Uganda, Western Nile Radio, and UBC Radio, and also streaming live. UBC Radio.
Hello, good morning.
A very good morning to you, sir.
Emmanuel coordinating from UBC West Nile Studio.
All right.
Yes, I'm Emmanuel Jawiyambe. My concern, first and foremost, I need to thank government for the yellow fever rollout vaccination that's taking place. But then I need you to also talk, the personnel who are there, talk about what are the causes of yellow fever, and then the side effect after vaccination to those who might not be feeling well after vaccination. And then lastly, I have a daughter who had yellow fever vaccination in Kampala some time back. But then at her school, where she is schooling in a secondary school in Kampala, when the vaccination is taking place, she's being forced to go for that vaccination. And as he tells these people that I've been vaccinated already, but then he's being forced. Now, this is supposed to be given once in life. But then what will the professionals tell us about this?
Okay.
Thank you very much. Thank you very much.
Welcome, Emmanuel, and greetings to the people of West Nile.
You're welcome. Thank you. God bless.
God bless you too. Live on Butebo Radio, Magic 100 FM, UBC Radio, and Western Nile. Thank you, Emmanuel. Is at UBC Western Nile in Alua. Serious concerns coming from the people of Uganda. The other thing that I wanted us to talk about in the few minutes that we're remaining is about surgery. What is my right when it comes to surgery? Sometimes persons are forced to sign those papers as they're taken to the theater. Is there information that I need to get or to be educated about before I'm taken to the theater? And some also Ugandans have had concerns. You go to the hospital, you are only nursing wounds, maybe you had an accident, and perhaps you have injuries on the legs and arms, and later on to find out when you wake up, you have a wound, a big wound, stitches on the stomach, and to find out your kidney is out. What should Ugandans do or Africans do when it comes to that? We're going to be talking about that in the minutes that we have. I'm going to get these concerns being answered by my team, 776511426, picking 1 to 2 callers, then we end this. UBC Radio?
Yes.
Your name, sir?
I'm called Mwasame Bennett, calling from Namsindwa district.
Namsindwa. I would request that you reduce the volume on your radio.
Okay, sir.
Thank you. Your concern, please.
My concern, I went for vaccination. So when I went in my yellow book, they told me that you have to pay 10,000. Is it free of charge or the government is getting money from? They told us that the vaccination is free. But when I went to yellow book, they told me you pay 10,000. So I'm very concerned.
All right. Thank you so much.
Okay, sir.
And the people of Namsindwa, we are glad that you are part of us, and we love you so very much, and we're here to inspire you with educative programs. Allow me go back to the studios for Dr. Ruanga and Dr. Awundo to answer these concerns. I would start with you now that you are in that sector that people have started to pay 10,000 for the cards. They don't know whether it is their right to get them for free or they have to pay some cost.
Thank you, the callers. Thank you for those questions. And I will start off right away with the question on yellow fever card.
If you can get this one as well as the last caller.
Right.
UBC?
Hello, UBC.
Glad that you're a lady. You're live and clear.
You're talking to Kathy from Wakiso.
All right.
Thank you for the services.
Most welcome.
Mine is an inquiry. Let's say from childhood, someone didn't take any vaccination. For the
Kathy, you're there? I've lost Kathy. You can call again on 776-511-426. But I think her concern was if she has never taken any vaccine or immunization, could she be back? Hello? All right. Does that have any consequences, or she can start later on? Sorry, Kathy, I think you have poor network. Let's continue because we have a few minutes to end this discussion. Awundo?
Yes. So the ongoing campaign for yellow fever, at the vaccination site, we are issuing the white cards. These are not the travel yellow fever cards. Normally, we call the yellow booklet. So these cards is one indication that you've been vaccinated, but two is the information captured on that card. It is the same information we capture on the EpiVac record system, which is an electronic data capture to make sure that your data is kept for forever. So if you are in Kampala or if you've been vaccinated by KCCA team, what you need to do is coming right now. You may find some difficulties because all our staff are deployed in the field.
When are they supposed to get the yellow cards?
We encourage that you can plan to come at least 2 weeks from now. But if you have an emergency journey, please, you come anytime. And come to only one place. That is KCCA City Hall Clinic.
Okay.
That is where the travel cards is issued from. But you will pay 7,000 shillings for the travel card, for the travel booklet. And you will not pay this in cash. they will guide you to go to the revenue office, and you pay that money to the URA KCCA revenue mechanism.
Thank you.
Usually they issue those they call them PRN, and you are able to pay using your mobile money. It is 7,000, and please do not ask anybody. You just come to City Hall Clinic, which is at KCCA headquarters, so that you avoid anybody fleecing you.
Someone who has never immunized.
Yes, we encourage them to get the vaccine. As the vaccine which they qualify for, because there are some they will not qualify for.
Okay.
By virtue of age, and so when they go to the health facility for the specific vaccine they need, they should be able to get that vaccine.
Time is against us. Your way forward and last comments on this.
Oh, thank you. My way forward is to appeal to Ugandans to have confidence and trust in the health system of the country. To trust what the government initiatives are rolled out, because they have good intentions, and we make sure that we train the people we deploy, but we also appeal to you to be vigilant in the case of any fraudster trying to take advantage. Please, we always share contacts. If you are in another district, you have the DHO contacts. Do not hesitate to reach out to them so that you verify and get the information. There is no reason why you should run to social media and listen, because those are the people who try to decampaign this on social media are also fraudsters in one way. They are denying you your right to health, and they are basically fighting to make sure that Uganda as a country will do not progress to the next level. I conclude by thanking UBC, but also thank my supervisors at KCCA, the executive director, my director, public health and environment, but also thank the team, a strong team of vaccinators we have deployed throughout Kampala, who are working tirelessly to make sure that Kampala is yellow fever free zone. We are sure we shall achieve this. Thank you very much.
Thank you, Dr. Wundo. Dr. Rwanga.
Yeah, thanks very much, Comrade Amon, for handling this program, and we also send special thanks to the callers. Some of the callers have mentioned that when you are donating blood, you should be motivated. I think there is a certain situation which we need sensitization and even to undergo some of the experiences. As I told you, I was hospitalized in 3 hospitals. But when I was being transferred from Mulago to Mengo Hospital, I was seeing most of the things upside down. And when I reported it that all the things are upside down, the medical team told me, you are lacking blood. And the first thing we are going to do is to give you this blood. So they brought those gadgets and I was connected. Then later on I started seeing things in their proper shape. But I felt guilty. In my life I have never donated blood. And if that blood had not been there for transfusion to take place, maybe I would be in a very awkward situation. And yet I used it to see some of our students in Amiriango College between 1977 to 1980, especially the late Mango, donating blood and others. So we need just to sensitize people that please, donating blood is a question of life and death. Once the medical people have seen that you are in a position to donate blood, kindly donate blood such that we don't run out of blood at any center. You never know when you need it.
David, I had a concern that when you donate blood, sometimes you are not given this blood when you need it.
No.
Is it the right to the donors only, or should donors have more rights than those who have donated?
Actually,
not donated.
Actually, what I was told is that for people who have been donating blood, they give them a special card. such that wherever they go, when they need blood and their immediate family members, they are not put so much on a waiting list because they are the ones contributing to that blood in those bloody banks. So the message should be really to sensitize people on the urgency of donating blood and on the healthy feeding. And because it is a healthy body which can help.
Doctor says we donate and blood is taken, but we are not informed back. Are we supposed to get, do we right to be informed that your blood was received, and should we receive the tests? Because be knowing that I've donated blood when actually is not going to be used.
That one is now more technical, but what I know, the blood they get from you, they test it first to establish whether it is not affected or free blood. Okay, that one they do, they know their medical procedures, and they even know how to keep the blood, and they even advise you how you should regain that blood after you have donated. Okay, this thing actually is a national call. It is not even an individual to benefit from it. It is just saving life for others and advancing the cause of humanity. And what we need to do to be more safe is for our people to be healthy and be in a position to donate blood minus any side effect. Yes, the side effect can be there that you have lost the blood you have donated, but recovering it, the recovery should be as normal, should be as smooth as possible. You see, any country's pride is how its citizens are. It is like when in the rainy season, you go out in the field and you see the green belt, all the green grass, all the green vegetable. You are more motivated. You cannot be a head of a state when out of 10 people, only 2 are eligible for donating blood. The rest have issues. That such a type of a country is worrying. Or you cannot be heading a government when your people don't even know the need of donating blood. So that means that public health and sensitization has to be stepped up, and that stepping up, all stakeholders should be involved.
Your way forward, Doctor?
My way forward would be any health system needs to be of quality, and once it is qualitative, it means that all our citizens would be using it. Right now, we have a biggest challenge that our our health system is not attracting our senior citizens, our leadership, our top leadership. They ignore it and go outside. And when they ignore it and go outside abroad, it means that they are not understanding the real challenges. And our real challenges have been the people manning the health sector are underpaid. Okay, their conditions of service needs to be improved, and they are still having those arguments. Where should we stay? How much should you pay? At times they even down tools that our job, we are essential workers, but we don't have protective gear, we don't have this. So we need to realize that the medical staff have to be looked after. Then also the patients' environments, which are healthy, which are good, should be created. We should not have this excuse that such and such a clinic center cannot carry out this simple malaria test, cannot carry out this typhoid test.
Right.
No, those should end. Health is my right, and health is for everybody. A healthy country will contribute genuinely in socio-economic transformation and prosperity. because everybody would be productive. Thank you.
Many thanks, Dr. Christopher Wanga from UPC, to make it a point to come and educate the people of Uganda on UBC Ground Zero. It was also a privilege having you, Dr. Christopher Wundo, coming from KCCA, and thank you for making it a point to come to educate the people of Uganda. Thank you those who sent in your messages. Thank you all the callers. Thank you all the listeners on 4 radio stations, on UBC Radio, on Magic 100 FM, on UBC Butebo, and on West Nile Radio. 7th April is the World Health Day, established on 24th, 1945. The main goal of the United Nations was to promote the worldwide peace, security, and better living conditions for everyone. And the key operation of World Health Day is to raise awareness among the people about the health issues they deal with worldwide. It also teaches us, the people of the world and the people of Uganda, people of Africa, the organizations and governments, how to address global health issues as part of the United Nations Sustainable Development Goals. I pray that you demand these rights. It is your right. It is your health. Go for these vaccines. Go for, and make sure you seek information that is concerning your health. Thank you, our dear guests. Thank you, the team that I worked with. Thank you, our dear listener, for being part of us. Until next time, same stations. For this time, allow me to sign out. For God and my country.